In this video, you will learn all about medical policies and procedures, what they are, common categories, and if they're really necessary. Hi, my name is Liz. Don't forget to hit the subscribe button and get notifications of future content. Medical policies typically address various aspects of patient care, including but not limited to patient admission and discharge procedures. Medical policies outline the standardized procedures for admitting patients into healthcare facilities and discharging them after treatment. These protocols help streamline the admission and discharge process, ensuring efficient and effective care transitions. Infection control measures. In order to prevent the spread of infections within healthcare settings, medical policies establish strict infection control measures. These policies include guidelines on hand hygiene, personal protective equipment usage, sterilization techniques, and isolation precautions. When I was around 17 or 18 years old and I was working with my mom in the local nursing home, she was one of the supervisors or department heads. That was actually something that I helped her and the director of nursing with a little bit. I really learned a lot from the director of nursing. She actually taught me a lot how to write policies and procedures, and then I also helped my mom write the policies and procedures for her department. Infection control is something that is a very big deal in any kind of facility. All right, so we also want to look at medication administration protocols. So medical policies provide detailed instructions on the safe and appropriate administration of medications. This includes guidelines on dosage, calculation, medication storage, handling, and documentation. By following these protocols, healthcare providers can minimize medication errors and promote patient safety. Something that's often taught to nurses and MAs or med aides is the 6 or 7 patient rights. You have to check like your medication card or your medication bottle against what's called the MAR or medication administration record. And usually there's about 6 or 7 different criteria you're looking at. You're going to look at the name of the medication, the name of the patient, the birth date of the patient, the type of medication, the proper dosage of the medication. Anyways, it's a whole thing. So each time that you administer a single medication, you have to go through all those rights. And believe it or not, you get pretty fast at it when you're administering a lot of medication. So, all right, then let's look at emergency response procedures. So medical policies outline emergency response protocols to be followed in critical situations. I remember working in the nursing home, we had an entire binder full of these. What would happen if we had a fire? What would happen if we had a tornado warning? And there were actually a couple times we had to go through those procedures because we live in South Dakota, so we would actually get tornado warnings and stuff. These procedures cover various scenarios such as cardiac arrest, respiratory distress, and trauma. They provide step-by-step instructions for healthcare providers to follow in order to deliver prompt and effective emergency care. And yes, we also had policies and procedures for those kinds of things, and how the charge nurse, head nurse, and director of nursing, and also all the other staff would respond to things like that. All right, and then documentation and record keeping guidelines. Accurate and thorough documentation is crucial for maintaining patient records and facilitating continuity of care. Medical policies establish guidelines for documenting patient information, including medical history, assessment, treatments, and outcomes. These policies also address privacy and confidentiality concerns to protect patient information. Again, you're going to hear the word HIPAA a whole lot anytime you're dealing with anything medical, and that is basically just about patient information and patient confidentiality and safety. So you're going to hear that a whole lot. All right, and then of course, quality assurance and improvement processes. Medical policies emphasize the importance of continuous quality improvement in healthcare delivery. They outline processes for monitoring and evaluating the quality of care provided, identifying areas for improvement, and implementing necessary changes to enhance patient outcomes. So something that might be part of your quality assurance process, and usually this is something that crosses multiple departments, so it's not just housekeeping, it's not just nursing, it's not just activities, but it's several different types of checks to make sure that your patients are getting the quality of care that they need and that they're not having any kind of like cognitive decline. For instance, if we have a patient that is in the activities room that usually was able to do activities, but that day they're not, then the activities director or the activities assistant would then notify the director of nursing or the charge nurse on staff, just kind of different checks and, quality assurance pieces like that. And the same for the policies and procedures. So I personally recommend you look at least lay eyes on all of your policies and procedures at least every 3 to 6 months. You're also going to want to check them whenever there's a change in the law, whenever there is maybe an updated Medicaid or Medicare policy, the same with insurance policies, those kinds of things. All right, and then we're going to look at staff training and competency requirements. To ensure that healthcare providers have the necessary knowledge and skills to deliver safe and effective care, medical policies establish training and competency requirements. In the nursing home, we actually had to do training every year, a certain number of hours every month. And what they did towards the end of me leaving is they would actually record all these on video so that during that gap between the training and the new year, if someone came on, they could actually show them those training videos so that they could have their competency. All right, now these policies outline the mandatory training programs, certifications, and ongoing education that healthcare professionals must complete to maintain their competence. And then we'll look at ethical considerations and patient rights. Medical policies incorporate ethical principles and guidelines to ensure that patient rights are respected and protected. These policies address issues such as informed consent, confidentiality, end-of-life care, and cultural sensitivity. They provide a framework for healthcare providers to navigate complex ethical dilemmas and make decisions in the best interest of their patients. So one thing that I can remember learning in some of the, let's say, cultural differences seminars that they put on in their nursing home is styles of communication. For instance, in America, both the wife and the husband, or the male and the female, you usually can separate the two and, talk to the woman about what's going on or talk to the husband about what's going on. But there are certain cultures, especially in certain parts of Asia, where it is more common for the male to be the one to do all the communicating. Even if the females or the wife is the one that's sick, he'll do all the communicating, a lot of the decision making and things like that. And so trying to be sensitive to all that and understand that that is a cultural norm for them is something, that they taught us and talked about. And I think it's great for anyone that works in the medical field, housekeeping, nursing, admissions, any of that, to actually understand some of those cultural differences. All right, so these policies and procedures are developed based on evidence-based medicine, regulatory requirements, and best practices within the healthcare industry. They serve as a reference for healthcare professionals to follow when providing care to patients, ensuring consistency and adherence to established standards. It is important for healthcare organizations to regularly review and update their policies and procedures to reflect changes in medical knowledge, technology, and regulations. This helps to maintain the highest level of patient safety and quality of care. My personal recommendation, like I said earlier, is to review them every 3 to 6 months, or with policy change, or with law change, or with circumstance change. Policies and procedures protect your private practice, your staff, and the reputation that you've worked so long to build. One thing that a lot of people don't think about where policies and procedures kind of step into play is, for instance, if you work in a nursing home, so every year, the states come in and actually do an inspection, and a lot of times at that time, they will actually look at your policies and procedures and then compare them to the way that your staff is doing what they're doing. So if the way that your staff is waking up and dressing the patient in the morning doesn't match the policy and procedure on that, that's actually a deficiency, what they call a deficiency or discrepancy, and you might get a ding for that. And then, you might have to change the policy and procedure. Lots of different things can happen. Actually, the surveys that they used to do have the ability and capacity to shut down a facility. I know that sometimes if the deficiencies are bad enough, they might have to put a pause on taking new patients until some things get addressed. So policies and procedures really are very, very important. They're also important if you're dealing with the Board of Nursing, or if you're dealing with the Department of Health, or if you're dealing with the Physicians Board, because they will all look at those policies and procedures to see if they are showing that everyone's working within their scope of practice. For instance, as a nurse, I cannot diagnose a medical condition that's within a doctor's scope of practice. So if the policies and procedures reflect that incorrectly, then that's an issue. The same with nursing. There are some advanced practice nurses that can open different kinds of clinics, but they do have to have all their policies and procedures on file. And I heard of a case not that long ago where there was actually a complaint against a facility. So the Board of Nursing came in, asked for all the policies and procedures. Lo and behold, the nurse had no policies and procedures written down on paper. So again, that is the importance of making sure that you have those written down, they're in practice, and they are regularly reviewed. Hey, thank you guys so much for tuning in. Don't forget here at Curate Systems that we minimize risk and maximize productivity by documenting it, delegating it, and getting it done. Thank you for watching.